Thorns on his head, a spear in his side.
I am new to all this technology stuff, so just bear with me. And apparently I wore the entirely wrong outfit. That's why I have to hold this. And if I flash anybody by accident, just tell me to close my dress. As Donnie said, mostly everyone knows me. My name's Ronda Thorington. I'm a licensed professional counselor, and I've been so excited for this conference for months now. It's so rare that churches even acknowledge the need for mental health care and mental illness treatment. So I was just so psyched that Donnie put this together, and even more psyched that he asked me to participate. I have a passion for mental health treatment and mental health services, and especially when it comes to children. That's how I ended up in this field. 5 lifetimes ago, I taught school 1 year, middle school in Baltimore City, and one of the things that was very apparent early on is that there was a lack of mental health services for children. And so after that year and bouncing around in some other jobs, I decided to go to graduate school for counseling psychology. And so fast forward 20 years and here I am now. So unlike Dr. Cassiano, I will not have brain scans or any of the real heady technical stuff. I am a child therapist, so I have cartoons. I have lots of personal stories and lots of just anecdotes to try to help to show you guys what some of these disorders look like, what some of these challenges look like: anxiety, depression, and trauma. So with that being said, one of the things that we want to look at is, why is this even important to talk about? So I looked up some statistics. 1 in 5 adults in the US experiences mental illness in a given year. So probably in a room this size, so maybe 4 people in this room would experience some sort of mental illness. And that's a pretty, sizable number in terms of percentages. 1 in 25 adults experiences a serious mental illness in a given year that substantially interferes or limits one or more major life activities. So what that means is, these are folks who their mental illness prevents them from going to work, prevents them from going to school, prevents them from having positive relationships. So 1 in 25. Even more concerning is that 1 in 5 youth aged 13 to 18 experiences a severe mental disorder at some point during their life. And for children 8 to 15, the estimate is 13%. And what we know to be true is that that number is increasing. And that's pretty scary. So I think, there's a lot of reasons why, that number is increasing. I think, as Dr. Cassiano spoke about last night, there's a lack of connectedness in our society these days that contributes to that. There's substance abuse, there's things like that really do contribute to an increase in childhood mental illness. When we are specifically talking about depression and anxiety, 6.9% of adults in the US suffer from depression. Now, to kind of help to put that in perspective a little bit, when you look at the amount of our population that has green eyes, only 2% of our population has green eyes. So there's more people in our country that have, Tina's raising her hand, she has green eyes. So there's more people in our country that suffer from depression than have green eyes. 18.1% of adults in the US experience some sort of anxiety disorder. Now again, looking at, to put it in perspective, only 10% of our population is left-handed. So, yeah. And Jim raised his hand. Yeah, unless you live in my house where out of the 5 of us, 3 of us are left-handed. So yeah. But again, puts things in perspective, right? This is something that we don't want to focus on, but such a huge percentage of our population has these kinds of challenges and difficulties. When we look at some of the causes of mental illness, there's, several causes. One would be neurological, and I think Dr. Cassiano spoke a lot about that last night. Just how our brains are wired can predispose you for mental illness. Genetic predisposition. What we know to be true, especially in disorders like depression or anxiety or even schizophrenia and bipolar disorder. If you have a first-degree relative that suffers from one of those conditions, you are at an increased likelihood of having it yourself. Excuse me. One of the things that I always do when I have a family come in, if I'm working with a little one, is I always get a very thorough family history. Anyone in your family have anxiety? Anyone in your family have depression? Now, lots of times, people, it will be undiagnosed. So the way I will frame it is, anybody in your family just seem really sad? Anybody in your family just kind of weird? Yeah. Do you have that weird uncle that nobody talks about? A lot of times that can be undiagnosed mental illness. Another cause of mental illness can be situational. Oftentimes we will see what we call a situational depression. So someone loses a loved one, someone experiences a tragedy, and they become depressed or anxious. Modeling. Now, that's something that we don't often talk about when we look at mental illness, but I often see this with children. So Susie comes in, she's 6 years old, she's a very fearful little girl. And I look at Susie's mom. Susie's fearful because Susie's mom is fearful. Susie's mom has instilled in her that the world is a scary place, that people will come to steal you, people are out to hurt you. There is no safety in the world. So Susie learns early on to be anxious. So I have first anecdote. We have a family member who, her daughter, when mom is around, daughter is very quiet, very shy, and she'll be completely up under her mom. Mom is very anxious. When mom is not around, this little girl is the life of the party. So she's learning to be anxious, and she's learning that from her mom. Another cause of mental illness can occur secondary to a medical condition. If you have a thyroid condition, that can cause anxiety. It can cause depression. If you have chronic illness, it can cause depression. It can cause anxiety. So there are lots of reasons why we can have mental illness. Do not fear, for I am with you. Do not anxiously look about you, for I am your God. I will strengthen you. Surely I will help you. Surely I will uphold you with my righteous right hand. Isaiah 41:10. Now, Dr. Cassiano used this same scripture last night. I swear there was no collusion. So, in fact, I love it because no collusion. I love it because when things like this happen serendipitously, I always feel like this is confirmation from God that this is what we're supposed to be doing. So when you look at anxiety, we all have anxious moments. There's a test that we have to take, so we're concerned about it. I was anxious this morning, thinking about speaking before you guys today. When we talk about an anxiety disorder, what we're talking about is the type of anxiety which interferes with your daily functioning. So like I said, you have trouble going to work, you have trouble with your relationships, you have just trouble living in the world, or as the young people like to say, I can't live my best life because of this. That's when we want to treat it. What are some of the symptoms of anxiety. Now, anxiety is so interesting because you can have emotional symptoms and physical symptoms. Some of the emotional symptoms, feelings of apprehension or dread, feeling tense and jumpy, feeling like you just can't even sit still, like you're just going to jump out of your own skin. Restlessness or irritability. Now, an interesting thing about irritability, oftentimes with little ones, that's how anxiety shows up. You know, you have a child in school who is oppositional or has aggressive behavior. Oftentimes, there's an underlying anxiety. Anticipating the worst and being watchful for signs of danger. That's another sign of anxiety. I had a young lady in my office last week, and she could find in a perfectly blue sky, she could find the one dark storm cloud. She is riddled with anxiety. She has a complete inability to find anything positive in any situation. So, and I shared that with her, and all she could do was laugh because she knew it was true. Some of the physical symptoms of anxiety: a pounding or racing heart and shortness of breath, an upset stomach. And the thing about, an upset stomach, oftentimes, when we hear the expression, follow your gut, there is scientific, evidence in doing that. Because what we know to be true is that, how Dr. Cassiano spoke about serotonin receptors last night, right, in the brain? We also have serotonin receptors in our gut. So when you're experiencing, oftentimes when people are anxious, they can have abdominal upset. What'd you say? The bubble gut. Yeah, there you go. Yes, exactly. So another physical symptom is sweating, tremors, or twitches. Headaches, fatigue, and insomnia. Frequent urination or diarrhea. IBS, right? We all know about IBS. A huge, anxiety component correlates with IBS. Oh, the other thing that I wanted to say is we're going to have time for questions toward the end, but, I'm very interactive, so if people have questions, feel free to, shout them out, raise your hand, so. These are some of the common anxiety disorders. Panic disorder. Now that's characterized by repeated panic attacks. And I don't know if anyone in here has ever had a panic attack. I have. I've had one. Okay, I see some hands. They are incredibly scary. You feel like you're gonna die. When I had a panic attack, I had been on a course of prednisone because I had some respiratory issues. And, again, when you're looking at some of these conditions, you want to look at the medications you're taking because prednisone is notorious for causing mood symptoms. So I was on a course of prednisone, and I was in, of all places, Chuck E. Cheese at a birthday party. And then all of a sudden, I felt like I wanted to jump out of my skin. My heart started racing. I felt panicked. I felt like everything was closing in on me, and I just had to get out of there. The other thing about panic attacks is they feel like they're going to last forever. And I know for me, that was the circumstance. Realistically, it probably went on for maybe 5 minutes, but it felt like 5 hours to me. So much so, this was, I don't know, maybe 7 years ago, and it's still ingrained in my memory. Another common anxiety disorder is generalized anxiety disorder. And with that, you're just anxious about everything. You find a reason to worry about everything. and you just can't get out of your way because of it. What if my check isn't direct deposited? What if I miss the bus? Oh, what if, my teacher doesn't give me an extension on that test? Oh, what if I fail? And it's constant running tape through your mind. Another common anxiety disorder, which is pretty challenging to deal with, is social anxiety disorder. Now, with social anxiety disorder, people have difficulty being in social situations. So there's a worry that, I'm going to say the wrong thing. I'm going to do the wrong thing. People are looking at me. People are going to judge me. And what ends up happening, if it's untreated, typically, is that people begin to isolate themselves more and more until they end up, in their homes 24/7. So, and I oftentimes will get clients in with adolescents who have a social anxiety disorder, and the parent's solution is to homeschool. Worst thing you could do. Because what that does is number one, it reinforces that there's something to be afraid of, so you need to isolate yourself. And number two, it reinforces to that person that this is unconquerable. There's nothing I can do, so I have no other resource than to stay home. I have someone now in my practice who, social anxiety disorder, among other things, and against my advice, decided to homeschool. Now this young person has difficulty even answering the door. This past Halloween, he couldn't greet trick-or-treaters because he was so frightened. Yes?
In general, you're not saying homeschooling is not a good idea.
No.
It's not a good idea for this disorder.
Yes, exactly. No, I'm not saying that at all. Yes?
What do you do for a kid who walks into school and, objectively speaking, the other kids are out to get them? They get made fun of and teased and bullied and all this stuff.
Mm-hmm.
Would you not recommend homeschooling in a case like that?
Mm-hmm.
Do you think we should tell our kids to stay and fight it out?
Mm-hmm. Well, one of the things that I would recommend is bringing the adults in, making sure that all of the school personnel are on board with and aware of what's going on, so that they can proactively help to make the situation better. So, yeah, that's what I would recommend, first and foremost. Yes?
Rhonda, would you be addressing a connection between emergency room, my experience has been anxiety, difficult breathing. I would run my son to Bristol Hospital.
Mm-hmm.
There didn't seem to be any help in the early stages of diagnosis.
Mm-hmm.
Is there today
Mm-hmm.
a connection between adolescents, he was 12 at the time, who are in the emergency room, and a connection with hooking them up with some kind of a social worker?
Mm-hmm.
It didn't exist back in the 90s. That's the only reason I'm asking, and maybe you will be addressing it later.
Mm-hmm.
But that has always been on my mind, that there were some missing diagnoses
Mm-hmm.
along the way, so that the interconnectedness between the medical,
Mm-hmm.
emergency room hospitals, and your profession,
Mm-hmm.
I think is very
Mm-hmm. Mm-hmm. Mm-hmm.
in getting it early, which
Right.
is what you're trying to do in your practice.
Right, absolutely. So what I will say to that is that back in the 90s, there was no collaboration between emergency departments and psychologists and psychotherapists. What has since developed, probably in the late 90s, and we can talk about this, emergency mobile psychiatric services were created so that children and adults, for that matter, no longer have to clog emergency departments with psychiatric concerns. So let's say you're home and Johnny is having a panic attack and you don't know what to do. Instead of calling 911 or putting Johnny in the car, which could be dangerous, you call 211. And a psychiatric clinician will either triage the situation over the phone or come out to your home and triage the situation. They give resources, they follow cases until children and adolescents can be connected to services. With all of that being said, though, there is a tremendous lack of mental health services for children in the state of Connecticut. So I have recently, a few months ago, I had a young girl, she was 12. She was, I'm looking in the audience to see what I can say and what I can't say. She had a lot of behavioral difficulties. She was smearing feces. She was starting fires. She was actively talking about killing herself. Sent her to the emergency room. The clinician called me and I said, what do you think? She said she needs to be here. But I will also tell you, I have 27 kids in the ED right now. She's not going to get a bed. I said, okay. Well, so that's where we are with children's mental health services in the state of Connecticut. So,
Thank you, Ron.
yeah, you're welcome. So, in order to visualize this a little more, again, I'm a child therapist. So when I was thinking, what could I show you guys that would really demonstrate like some of the generalized anxiety that I'm talking about, I thought I'd share some Winnie the Pooh. We're gonna look at Piglet.
You're going to be quite all right. Because this year is going to be the year. This Halloween, you're going to enjoy yourself. Nothing is going to frighten you. There. I'm not scared of something as frightful as this. I'll be unafraid of anything. I hope. The foolish goblin, the ghastly ghost, everything scares me the most. All I really want to do is be with Pooh, Eeyore, and Tigger. Kinda creepy, sorta scary, yes, but maybe not so very. Well, in order to be brave, I tell myself that I am not afraid. No, not too much. And if I am not afraid, not more than a touch, I can be around my friends. And being with them is much better. We might be more brave together than I can say that I am not. What if some spook comes up to me when it's dark and really gloomy? How very grand to stand up tall, but could I even stand at all? I don't have one scary feature, a timid, small, and frightened creature. Dear, oh dear, I'm just not brave. I want to tell them I am not afraid. No, not too much. And if I am not afraid, not more than a touch, I can be around my friends. And being with them is much better. We might be more brave together. It's Halloween, I'll face my fear, 'cause it's the spookiest night of the year. What a very grand thing to be so brave, to show myself that I am not afraid.
So I think, our friend Piglet showed us lots of different characteristics of anxiety. He had the social anxiety. He wants to be with his friends, but he's so afraid. He can't leave.
Well, one good thing about Piglet is that he seems to know he has a problem.
Well, yes, he does know he has a problem. Yeah. And lots of people, you bring up a good point, Stacy, because lots of people, with anxiety disorder, they don't want to be that way. They want to be out and about socially. They don't want to have these pervasive fears. So, any other questions? Nope.
What is a shot?
Hmm?
What is a shot?
Well, shy is okay. Shy is when here's the thing. When shyness gets in the way, again, of you living your best life, when it prevents you from getting out and doing things, then it becomes a problem. So, one thing that can happen with, again, with children, and adults too, who are extremely, extremely shy, is they can develop a condition called selective mutism, where you are riddled with so much anxiety you cannot even speak. So, I had a young lady like that several years ago, where she would come in my office when I worked on Saturday. She was my 8 a.m. every Saturday, and we would have a session in complete silence. She came in, her bangs would be all the way down here, and her head would be down, and she would not say a word. So we would spend the session drawing pictures, as a way to help her communicate her anxiety. And once I'm not staying in the square, wait a minute. Okay. And once she was able to express it and develop some tools to manage it, eventually she came out of her shell. And then she came in one week and her hair was out of her face. And she made eye contact and she said hello. And then fast forward a few months, she was going to dance classes. She had a playmate that she was connected to. So yes, shy is okay. Extreme shyness, where it prevents you from interacting, that's when it's a problem. You had a question.
Yes, I'm learning more about the anxiety disorders and how they manifest themselves. Can you share with us, especially with children, other ways besides, let's say, the traditional shyness that anxiety manifests itself?
Okay, absolutely. So a lot of times with kids, anxiety they can be very irritable, very angry. They can, oftentimes I'll get a kid in who will have these explosive outbursts. And, another clinician has, possibly labeled them with a diagnosis of oppositional defiant disorder. They're just oppositional just for the heck of it. They don't care. No. Underlying, it's anxiety. I am terrified, so I am in, that how Dr. Cassiano talked about the fight, flight, or freeze. So I'm in fight mode all the time. So that's how it can manifest. And again, with the selective mutism as well. The social withdrawal. All of a sudden you have a kid who used to have all of these friends, and now on the playground they're completely isolated. That's oftentimes how anxiety looks in children. Yeah. Yes?
Got a question. You can born like that with these kind of disorders from the very, the very beginning?
Well, you can.
Because I
Okay.
got a grandkid.
Mm-hmm.
Then at the beginning, he was acting like very normal,
Mm-hmm.
very hyper, very normal.
Mm-hmm.
Now, he's 14 years old, and they diagnosed him with some kind of disorder,
Mm-hmm. Mm-hmm.
social disorder.
Mm-hmm. Mm-hmm.
And I feel so sorry for him because it's a big change.
Mm.
I mean, big change.
Mm-hmm. Mm-hmm.
I wish I could help him.
Mm-hmm. Well, what we know to be true is that there can be a genetic predisposition for certain disorders. So if, like I said earlier, if your mama had anxiety, you can have anxiety. If your daddy had depression, you can have depression. If Uncle Junebug had schizophrenia, you're at greater risk for developing schizophrenia. So, doesn't mean that you will get it, but you're at greater risk for it. So, and there's also the the family dynamic piece that, plays a role, and all of that. So, yes.
Is it scary that today in our society, more people are turning to medication as a solution to their anxiety? And are we trying to wean them off of that? Encourage them to get more therapy?
We're actually going to talk about that. You're one step ahead of me. So, when you have an anxiety disorder, one of the things you want to do is you want to get an evaluation to be sure. So you want to rule out any kind of medical condition. So I had a client who came in, adolescent boy, one of the worst cases of anxiety I had ever seen. Just even discussing an anxiety-provoking situation prompted him to have a panic attack in my office. What we found out is that he had an undiagnosed strep infection. And that's what caused his anxiety. Once that infection was treated, his anxiety went away. So you want to get an evaluation to be sure. You want to, yes?
I was going to say, I've also seen children present with anxiety when they've had respiratory problems. So when they struggle with breathing or if they have asthma, that can bring on also panic attacks.
Yep.
Because it makes them very fearful that they're going to have an attack and they can't breathe. And they know that.
Exactly.
So it's very fearful. So a lot of times that's a medical induced type
Yep.
of anxiety.
Exactly. I will share with you, one of our daughters has some medical issues that most people here know that causes a lot of pain. She had a panic attack after a severe pain episode, and we didn't know what it was. And, like you, Nancy, we rushed her to the emergency room and found out that, it was a panic attack. So, but brought on by extreme pain. Yeah. So, self-care. Self-care is so important when it comes to treatment of any disorder, really. But specifically when we're talking about anxiety, we want to look at the types of self-care which involve calming yourself. So remember Dr. Graciano spoke last night about self-regulation and all of that, settling down the activity in the brainstem. So what that looks like is, having, in a child, setting aside time for quiet activity. One of the reasons that there's an escalation in anxiety disorders in kids is because they're overscheduled. So there's so much of, okay, we're going to go to school, then we got track practice, then we have tutoring, and then we have basketball, and then we have to come home and do homework, and then we go to bed, and then we get up the next day and we do it all over again. Yes?
It also causes a lot of anxiety in parents.
Yes, absolutely. So, one of the things that I will always recommend to parents if their kids come in with an anxiety disorder is I tell them, Johnny's overscheduled. You got to cut out some activities. And they always look at me like I have two heads. So, because that's the last thing they want to hear. So, but anyway, calming activities. So in adults, that looks like meditation, prayer, being outside in nature. It might sound, a little hokey, but really being outside in nature does something to us physiologically. Had a young lady in my office 2 weeks ago. I got a ton of stories. 2 weeks ago, she's got some trauma, lots of anxiety, lots of depression, and it just envelops her. So, and I always can tell, I walk out of my office into my waiting room and I can take one look at her and tell how she's doing that day. And this particular day, she came in and she had on a hooded sweatshirt. She put the hood on and tied the sweatshirt. So all I could see was her nose. That's how bad of a day she was having. Once I convinced her to take the hood off, she just started sobbing. Couldn't even verbalize anything. So I said, okay, we're going to switch gears. My office backs to the Hockanum River. So I'm able to go out of the kitchen and stand at the river. It's really beautiful. And so I said, all right, come on, let's go. I want you to go in the bathroom, splash some cold water on your face, and meet me in the kitchen. And she did that, and we just went outside. And we stood there and watched the water rushing along the river for like 15 minutes. Didn't say a word. We just stood there and watched it. Then we went back into my office, and I said, how do you feel? She said, I feel better. So, just being in nature, yeah. So, psychotherapy for an anxiety disorder. You know, the purpose of psychotherapy is to help people understand and identify triggers to their anxiety, and also to develop coping strategies to manage those kinds of challenges. So if somebody has an anxiety disorder, I want them to understand, okay, what's going to escalate my anxiety? Because when you're feeling anxious, the last thing you want to do is focus on it. Okay, why am I feeling anxious right now? You just want to like, oh my gosh, I just want it to stop. A therapist's job is to help you kind of look at it from a more intellectual way and see, okay, what triggered that? Because if you have a greater understanding of it, then you have greater control over it. Universally, what I hear from kids and adults alike who come into my office with an anxiety disorder is they feel, number one, terrified, and number two, they feel like they're the only ones in the world that are experiencing this. So I tell them all the time, there's nothing you could tell me that I haven't already heard before. You know, some people have told me this, some people have told me that. You know, this is what helps some people. This is what helps other people. So just kind of having that understanding helps them to feel more in control and more empowered. So that's the purpose of psychotherapy. Now, medication is a last resort. So psychotherapy should always come first. See if it works, because you might not need medication. Yeah, do you have a question?
I was also thinking self-care. I need to back up that. But the person's self-esteem starts to go down. Some people you're mentioning, they have a lack of self-care for themselves, their inner being of who they are.
Yep.
So when they start looking shabby or they start not paying attention to how they hear, that's a sign too.
Absolutely. We call those ADLs, activities of daily living. So when I have a client who comes in who hasn't bathed, if they have a body odor, if their clothes are dirty, if they look disheveled, then I know something's really going on with this person. And this particular young lady that I spoke of with the hoodie tied around her head, she had challenges with bathing. You know, she would come in and she'd say, I haven't taken a shower in days. I don't remember the last time I brushed my teeth. So, you know, some of what I would do with her is help to hold her accountable. I give her homework assignments. Okay, when you leave here, you need to go home and take a shower. You need to brush your teeth. And then you need to text me and let me know it's done. So, yes, Stan.
You find out that people that start with self-care, do they also start self-medication? Like drugs, like alcohol. And they skip the psychotherapy, like Dr. Noel was saying last night. And that before they get into psychotherapy, they were already lost.
Yeah. I often see clients who, have self-medicated prior to coming in to see me. I always have to do, an assessment to see, okay, is this person even capable of being in therapy right now? Or do we need to focus on getting them clean first and then have them come back and start therapy? That often happens. Or they may go to what's called a dual diagnosis program, where it's a program that manages mental health issues and substance abuse. So, But yeah, none of this works if you're not clean. Yeah. Yes.
Do you guys correlate also with like dietary and like physical exercise to help too? 'Cause that's
Yes.
puzzle.
Absolutely. That's one of the things when I'm assessing people, I always ask about their diet. I always ask about their level of physical activity. Because especially when you're looking at someone who's depressed, physical activity, it makes you feel good. I mean, you may not feel good when you're doing it, but afterwards, you feel good because those endorphins are released. So I always talk about that. And diet is so paramount. Most of the people I see that have issues with depression or anxiety, their diets are terrible. You know, and I always have to chuckle when I get a family in and, okay, Susie cannot sit still. I don't know what is wrong with Susie. Okay, what did Susie eat for breakfast? Oh, she had Captain Crunch and a donut, and then she had some Kool-Aid. That might be why Susie can't sit still. So you always want to look at diet. And I think, you know, another aside, when you're looking at, there's a correlation between the dyes used in drinks and behavioral issues in kids. So we noticed years ago our son, when he would drink something like, you know, Kool-Aid or Hawaiian Punch or something, he would just get irritable. And I'd be like, what in the world is that? Okay, no more Kool-Aid in the house. And it really changed how he was able to interact and function. So diet is huge. Did you have a question? Yeah.
Looking back at you get an evaluation to be sure part of it. How do you know, I guess sometimes when you have maybe kids that don't present with the kind of, able to see this is really wrong with this child, or a child presents and, it comes in and won't look at you. But you get a child that maybe looks normal or has, how do you determine this is a healthy anxiety and this is just a child being nervous when you don't see any of those particular signs? How are you sure?
It's about how are they able to function in their life. You know, a child that has, some level of anxiety, but, they have friends, they're able to go out, they're able to participate in school, they're able to be in their families and not isolate. That's a child that I would say, yeah, they're probably a little keyed up for some anxiety, but they're okay. We've got one of those living in our house. So, Tina, and then you. Yeah. Oh, geez, I didn't even get to depression. Okay.
Lisa and Emily both suffer from migraine. And the doctor said a lot of it is anxiety based.
Yep.
So she recommended for that medication. As a big component.
Yep.
And sleep, trying to do their stuff.
Yes, there's the whole, we didn't even talk about this, but the whole mind-body connection. Our brains are so strong that we can, it can cause us to, have headaches. It can cause us to have abdominal pain. It can cause us to, a condition called conversion disorder. If your brain is so anxious, it can make you not walk. It can make you lose function in your bowels. And it's a legitimate physical manifestation of a psychological issue. So, yes. Did you have a question?
Yeah.
Oh.
Yes, I did.
Okay.
Do you use music in your?
I do, actually. I do. But the way that I use music is in a few different ways. Sometimes I will use it with kids in that, especially if I have a child that it's difficult for them to communicate what's happening with them, I'll ask them to bring in a song that, communicates what's happening in their life. So I had a client once, it was so cool, a young woman, and she was a musician. She would write songs and come in and play them on her guitar. So as a way to communicate what was happening with her and as a coping strategy. So music was very calming to her. Yes, Stan.
You find that, back in self-care, you find that people, like we're talking about exercise, have you got into any talking to people about being on multimedia too much?
Yes, yes, exactly, because that's, it can be addicting.
Depression, I mean, a lot could come from that, not
Yeah.
just from not exercising because you're on your phone or your tablet all the time, but I mean, the interaction, there's no one-on-one interaction with somebody.
Right.
It's just over multimedia.
Right.
which is-
Yes, social media causes a false sense of intimacy. I have a kid that comes in, I have 300 friends on Instagram or Facebook or Snapchat or whatever. Yeah, exactly. And I'll say, so how many people are you sitting down with face to face and talking with? Because that's true intimacy. The other thing I will talk with young people about, and adults too, is about how on social media, everybody's life is wonderful. Nobody has any problems. And when you see that, it makes you feel like, well, geez, what's wrong with me? So I talk with people about how, yeah, that's fake. There's nothing real about that. Yes.
Isn't
I know.
it true with these illnesses that the people are trying to hide it and it makes it worse?
That can yes, that can be true as well. Yeah.
Instead of getting help, they make it worse because they're trying to hide it.
Right, exactly. And that's why conferences like this are so wonderful, because we're putting it out there. The more authentic and transparent we can be about these issues, then the less apt people will be to hide. So, and I have to stop because I'm being told to stop. So we're going to take a break and we'll pick up with, depression after the break, I guess.
All right, guys, I know we have a lot